Signs that you have a bad dentist is they're probably not laughing and they're probably not taking you very seriously. It's a strange paradox that when we're in the dental chair, we have to know what the hell we're talking about, but we also need to be very personable because it's a stressful scenario. So a good dentist, really what it comes down to is having the technical skills to get the procedures done so they last a long time. They have a personality that you like, and that's subjective. And frankly, that they have an environment that's conducive to you getting good dental treatment without being stressed out. So that means the staff, everyone around them are people that are good, genuine people that are also trying to help you consistently. What I've realized in general is people will surround themselves with those that they're like. But a lot of dentists, when they don't take that ownership position in a practice, function as employees, and that employee kind of philosophy tends to rub off on the entire environment. If you've been to enough dentists, you've felt this. Either the dentist takes ownership of the practice or they function like an employee. When they take ownership of the practice, they tend to care a lot more about their patient interaction. They care a lot more about the flow of the treatment. They care a lot more about having an end result that they don't have to keep coming back and fix. When they're more of an employee perspective, it tends to be like, okay, I'm just here on the clock. I need to get my job done. I need to do these procedures as quickly as possible. I don't really care whether or not the patient likes me because I might not even see them again. So the reality of it is it's a subjective game, but if a dentist can't tell you logically why they're doing a treatment option, you should really, really consider maybe asking them some questions to clarify. The other thing is doctor in Latin means teacher. And it's always the fault of the teacher if the student doesn't understand, okay? So that means that if they are not putting this into words that you can understand, or they're not trying to put you into a position where you're going to be more educated leaving, then chances are that they're not fulfilling that basic doctor role. Now, I could talk shit forever about dentists, right? Because I went to dental school and frankly, I don't think most of my class was phenomenal or that they would function as phenomenal dentists. But the other thing is, it's not an easy career. And I think it really requires a sense of empathy for the fact that you're literally in there with binoculars on for like 8 hours a day and you're like drilling these little holes and trying your very hardest to get rid of saliva. There's all these different, there's a big cheeks sometimes, the tongue is like trying to play games with you sometimes, you know, there's like a lot of stuff going on. And on top of that, there's these high anxious emotions all the time, right? You have to deal with people being literally like 10 times a day, I get told, I hate the dentist to my face. And I'm like, okay, cool, I'll try to make you like me. You know, starting off an interaction like that, like you gotta have some tough skin to do this career in a sustainable way. So when it comes down to finding a good dentist, I would just, you know, go around, see what people are like, see what personalities you're in for. If you want to get quickly in and out, go and find that dentist. If you want to have a relationship with that person, they're going to be in your face, like makes a lot of sense. Make sure that you like that person. The other thing is you got to realize that your resources are going to determine the dentist that you receive. Right? A lot of people come to a dental practice, a Medicaid practice, for instance, and they're like, oh, I only want to see you, or I only want to do this thing, or I'm like, dude, you're not even paying for your dental treatment. Like, it's a business. You know, at the end of the day, like, I have a job and I get paid from it, right? So you have this interaction where your dentist cares about you and does all this stuff, but like, you're having a service delivered, right? And that requires an understanding of, okay, what is pricing? What are the things that I'm looking for? Is it realistic to have these high expectations if I'm literally paying nothing for it, right? Or if I'm paying a lot for it, why is my dentist treating me like shit? So it's a serious, and there's lots and lots and lots of really bad interactions with dentists because we don't get taught all of these soft skills in life and in school. We're focused more on drilling millimeters. So as you can imagine, there's quite a difference in terms of understanding a millimeter and someone's personality, right? And what they want to go through and how to teach people. Those are two completely different opposite ends of dentistry, and the best dentists understand both of them really, really well. This is Dr. Turab Rai from Franklin Dental Care and Dentures. Take care of yourself, and I'll see you here.